Hello, my name is Stephanie Nolting. I'm a physical therapist at Physical Therapy Connections in Pueblo, Colorado. I want to give an introduction to pelvic floor rehab, which a lot of people don't know what a pelvic floor is. So, dysfunction in a group of muscles that is the undercarriage of our core can cause several different problems, from bladder control to sexual dysfunction to pain. So it's important in everyday life. Those muscles are used whenever we walk, bend, crawl, climb stairs, and is very important that it stays in a healthy condition. And the muscles of our undercarriage, under our trunk, which I'll show you a picture of in just a moment, they need to function like any other muscle in the body. So our bicep muscle, for example, we want it to be strong, but we also want it to be flexible. We want it to be fast at times, and we want to have good control over it, so it's not either just short or long, but it can do very fluid sort of movements. So everybody should know a little bit about their pelvic floor. And very often I get patients that come in and go, why don't people just educate more for public knowledge, whether they teach it in school or wherever else? And there is not a good place for people to get good information about the pelvic floor. So I want to give you a good foundation of that now, so that you feel comfortable with just some of the introduction of what is the anatomy, what is healthy tissue supposed to be able to do there. So the first thing I'm going to do is show a picture of it. So I'm going to get a little bit closer here. It might take a moment to focus. So the pelvic floor anatomy, this is a side view of the body. This is the tailbone, and this is the stomach over here, and this represents the pubic bone up front. So there's some of our bony parts that have been taken out of this picture so that we can see inside. This particular picture is the female version of this. The muscles that run in between that tailbone and pubic bone are the pelvic floor muscles, and they create a little sling when we look at it from the side. Their purpose in life is to create support for all of the intestines and organs inside the body. They work during sexual function, and then they control bowel and bladder process. So that sling formation has to work a little bit like a trampoline when we run or jog or sneeze or cough, because the diaphragm pushes down very suddenly and aggressively, and the muscles down low should be able to respond very quickly to reactions of pressure change inside the abdominal cavity. So those muscles need to be fast and coordinated for that. Those muscles from a bottom-up sort of view is where this top picture comes in. In the top picture, we can see that there's muscles going from front to back, side to side, diagonally, kind of along the curvature of the glutes, and even circular muscles exist in those pelvic floor muscles. So they go in lots of different directions around the body. It's not just one simple sling. And so there could be some muscle tightness in, say, one area of muscle, in the same way that we get muscle knots in our shoulder muscles. And so muscle tightness is often one of the dysfunctions that we see in pelvic floor. And whether it's a leaky bladder problem, painful issue, people will assume that it's a muscle weakness that is contributing to their issue, whether it's pain or lack of performance. But oftentimes it's muscle tightness and lack of coordination in these muscles that creates the dysfunction, and not weakness. Most people in their lifetime, I won't even say most, maybe half, a little more than half, have heard about Kegels. And Kegels are the exercises that we do to work these muscles. But a lot of times people will get the introduction of Kegels from a doctor or even a friend or family, and they go, oh yeah, it's like cutting off the flow of urine. And people can appreciate that. Okay, cutting off the flow of urine. Oh, it feels like that. I'm going to go try that on the toilet. When you go to the bathroom, relieving yourself, man or woman, doesn't matter, gender, the bladder itself responds to emptying by us relaxing these pelvic floor muscles and some of the other pelvic floor muscles, whether you're sitting or standing. And that relaxation of the muscles gives a nice strong contraction of the bladder, so we empty in one steady stream. And a weak bladder can be a little bit different part of dysfunction for bladder training, because pelvic floor muscles are a little bit different than the bladder muscle itself. But we have to have good control and awareness of our pelvic floor muscles in order to talk to the bladder. So the bladder, working on the reflex of, if body is moving and in motion, I'm just holding urine. But if body gives me a certain relax signal, then I contract and I empty. So if there's some of that abnormal tightness in the muscle of the pelvic floor, that can be drawing some pressure and tension away from the opening of the urethra where it exits the body, and that pressure tightness can gap our closure. And so some people will notice a slow trickle effect if they're noticing bladder control issues. So it's not always that urgent, oh my gosh, I have to go right now sort of leak. Sometimes people will feel spurts of leakage because they're exercising. With painful issues, it can be during intercourse or pelvic exams, or sometimes it's just a general pelvic pain that happens all day long. And then, of course, sexual function for men and women. The performance of muscle being able to do its job also relies on the health of these muscles, from not just strength, but also abnormal tightness, coordination, and those things. So, since I talked about the bladder muscle a little bit, the bladder itself is a muscle. So the inner lining of the bladder needs to be fairly happy. If the chemistry inside our body is a little bit off, then the bladder gives people that sudden, oh my gosh, I have to go to the bathroom right now, that sudden urge. And so urgency sometimes leads to leaks and sometimes it doesn't. But the urgency is usually an imbalance of what is in the body and irritating the inner lining of the bladder, which could simply be from dehydration. A lot of people don't get quite as much fluids as they should in their day. The average that people should be targeting is half their body weight in ounces. So if you were someone that weighed 200 pounds, you should be getting 100 ounces of fluid in your day. And the fluid can come from lots of different things. It doesn't have to just be water, but anything that has alcohol or caffeine in it is a diuretic, so we don't count those fluids quite as much as our other juices, milk, water, and so forth. If you're getting the right amount of hydration in, when you go to the bathroom, that bladder should fill up 500 milliliters of fluid, which takes us about 30 seconds of a steady stream to evacuate. So if on a general day you are just counting and going, I wonder if my bladder is truly all the way full, and you hear the stream hit the water, you should be able to count for 30 seconds and get a nice steady stream for that amount of time. If not, then you might go, ooh, maybe I'm not getting enough fluids, maybe I'm not holding on to it as long as I should. For a normal circumstance, people should only have to go eliminate the bladder every 3 hours during the day. 2 to 4 is still within normal. 3 is kind of that in the middle target. And that in itself, the peeing for 30 seconds and having 3 hours in between bathroom trips, surprises a lot of people. And if that sounds like, wow, 30 seconds is so crazy, I don't think I could ever get there, I promise it's possible. Or I kind of spend all my day in the bathroom. Every hour I'm going to the bathroom. There's a way to train your bladder so you're not going as frequently, can fill up the bladder more and get a stronger contraction. So one of the things that happens with people that go too frequently to the bathroom, either because there's urgency or they're just in the habit of that, is that the bladder itself as a muscle doesn't fill up as much, so it becomes smaller and weaker. And that weak muscle over time can even kind of lean on its side and produce poor emptying. So there'll be less steady of a stream, higher risk for bladder infections, and there can be some other things associated with those too, but those are the two main things that we want to avoid. So that weak bladder, once we fill it up and hydrate it more and hold for longer periods, gets stronger and it stands up better in the body for better elimination. So the Kegels that most people have learned as it's like cutting off the flow of urine. It's true that that's the right area. It should feel like you're cutting off the flow of urine, but that's the wrong time to practice. There might be a test you do on occasion, like once or twice a year, where you go, oh, can I cut off the flow of urine, to see if you've got strong muscles in the area and to know, am I using the right muscles? But there's also different ways to know, is that muscle strong and am I using the right areas? the bad thing about going to the bathroom and trying to cut off the flow of urine is that it interrupts the muscle contraction of the bladder. So if the bladder is starting to empty and then we go, wait, I got to cut off the flow of urine to see if I'm strong, then the bladder has to pause and not have a full muscle contraction. So that in itself, especially if you're doing it repetitively every time you go to the bathroom or even once a day, can lead to muscle weakness, which we don't want to do. So if you're practicing Kegels on your own, you should do it any other time except when you're peeing. The strength of Kegels can be graded like we do in other muscle areas of the body. So if you ever had your muscle strength tested, say for your arms or legs, someone's likely graded that on a scale from 0 to 5. 0 is there's no function of the muscle, and 5 is it's perfectly strong and can hold against resistance. The pelvic floor muscles can be tested in an internal assessment and graded the same way, 0 to 5. But to do a very subjective, easy to do at home sort of test is that you should be able to do 10 Kegels in a row where each of those Kegels feels just as strong as your first one. If there is a change in how strong they feel, then there's likely some weakness there. It is possible to feel strong through 10 Kegels but still have some weakness going on. But like I said before, a lot of times weakness is not the issue that we need to solve when we're trying to solve other problems related to the pelvic floor. But it is definitely a good thing to test and know how those muscles are functioning. So when you do a proper Kegel, it should feel not only like you're clenching, like cutting off the flow of urine, but also lifting. Because when we were looking at the pictures earlier, it created that hammock effect. So you should feel like your hammock lifts up into your body at the same time that those muscles are clenching. So a proper Kegel, you feel a clench and a lift happening. It is just as important to feel those muscles relax after you've done a Kegel as it does to tighten them. Because some people are very efficient at tightening, but they're not efficient at relaxing if they have abnormal tightness. So it might take considerably longer to relax for some people. And that would be something if you're just doing a Kegel and going, okay, I'm going to tighten my muscles, and then you feel them relax. It should take the same amount of time to tighten as the time it takes to relax. You should also be able to, in kind of an advanced, I'm very good with my body awareness and I can feel things, you should be able to feel a difference between the front half of the anatomy and the back half of the anatomy. And we'll go back to the picture here for just a moment. So in the anatomy, the front half is the urogenital triangle, and it controls bladder control. And we should be able to do a Kegel that is isolated to that front half under the genitalia, and back half around the rectum, which is for bladder control. So in general, when people first learn about Kegels, they're just knowing that the whole area is supposed to do something, which is true. But to have that very specific isolation of, are those two areas able to feel a different muscle contraction if I'm encouraging them to? And that's easiest to check at home if you just simply sit in a chair, and to check the front half, you lean forward and you're squeezing like cutting off the flow of urine and lifting. And for gentlemen, it'll feel like you're trying to lift the testicles into the body. And women, it's the squeeze and lift, but it's close to the vagina. When you lean back, you should be able to squeeze and lift specifically at the rectum and just know that, oh yeah, squeezing at the back, that feels different than squeezing up front. Yep, okay, then that's normal, that's good. There's also some advanced control beyond even that, but for kind of beginner level, that's the first thing to kind of get awareness of when you're learning about the pelvic floor. So we talked about strength and being able to do 10 Kegels in a row. The next thing you can test at home and know if your pelvic floor is doing what it should be doing is endurance of those muscles. So if you have 10-second endurance and you can tighten the muscles and then look at the clock and make sure I'm holding this muscle tight, 10 seconds is going on the clock and I'm still breathing, because stopping breathing while you're holding that muscle tight is a compensation. You wouldn't want to use that compensation or other body compensations, because it's just an identifier that those muscles aren't performing exactly the way that you want them to. But if you can hold for 10 seconds and you went, oh yeah, that muscle didn't relax until I told it to, it's a good sign that those muscles have proper endurance. If you feel like that muscle fails before your 10 seconds is up, you know there's some improvement to be made there. Or if you know, oh man, I can't hold it for 10 seconds unless I'm holding my breath. The other compensations you would look for is if your glute muscles, ab muscles, or even thigh muscles want to help with your Kegels. So if you're tightening and your other body parts are moving while you're trying to Kegel, that's a giveaway that your pelvic floor muscles are probably weak because they're recruiting help from the surrounding muscles to go, I can't clench and tighten all by myself. I need the glutes or I need the abs. You guys help me out so that I can get a muscle contraction. One of the other common dysfunctions in the area for women, it can happen with men, but more so with women, is prolapse. And so prolapse is very specifically a muscle weakness issue. And compensation, if you've got so much weakness that prolapse is already part of your situation, you want to allow compensation. So if your pelvic floor muscles are so weak that they need help from the glutes or the abs or surrounding muscle areas, that's an okay thing to do in the beginning. As you get stronger and you feel better muscle contraction in the pelvic floor, then you start to get rid of your compensations from glutes and abs and other muscles. So that in the long term, you should be able to Kegel while people are around, but no one knows what you're doing because it's so underneath and internal that it's not a showy exercise. And you should be able to have a conversation with somebody and not have to change your airflow necessarily during Kegel exercises. The next test that you want to do for your pelvic floor to know how close to normal you are is speed of your Kegels. So earlier I was talking about that sling needing to recoil during a fast action, whether it's jumping, running, sneezing, coughing, and that fast action is important not to have a leaky bladder. So if you can do 3 Kegels in 3 seconds, or 1 Kegel per second, then you are perfectly on track for timing. Keeping in mind that as you Kegel, it should be a tighten and relax 3 times to get 3 seconds, and not a tighten, 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 okay, I did all 3. Faster than 1 Kegel per second is still okay, but the performance might be a little bit skewed into the I tighten, tighten, tighten. Okay, it took less than 3 seconds. But what we're more worried about is if it takes me 6, 10, 20 seconds to do those 3 Kegels, the muscles aren't performing fast enough, and the delay in how quickly you can do Kegels will interrupt your ability to have a conversation with your bladder if bladder control is part of a dysfunction that you're having. When people are trying to work on bladder control, whether it's urgency of getting to the bathroom on time or just having that, okay, it's not an emergency to get to the bathroom, I can just control it easily, or I'm trying to not go to the bathroom every hour, I need to increase my time in between bathroom breaks, 3 fast Kegels are one of the wonderful ways that you can start to talk to your bladder and control it better. So as you do 3 fast Kegels in 3 seconds, that would send a electrical message from the muscles to the brain to tell the bladder there's movement happening under the bladder, so the bladder is not going to contract. Because remember, that bladder should only empty when everything else is relaxing. So if you have quick Kegels, that is a good message relay. If your Kegels take you 10 seconds, then it is so interrupted and slow signal to the brain that by the time it gets down to the bladder to have that conversation, it's like a whisper. The bladder doesn't even hear it. It's on its own agenda. So while people are working on Kegel performance, pelvic floor performance to be able to get the fast Kegels, you can even use other muscle activity, whether it's from the legs, feet, particularly heel taps is what I have people do to start to control the bladder. And if that bladder is not letting me get to the bathroom on time, not letting me have enough time in between bathroom breaks, I can give it the message of I'm going to tap my heel, one or both feet, on the floor 3 times quickly or more, and that message tells my brain, oh, body's in motion. If I'm busy and moving, well, then the bladder's not going to be emptying, or shouldn't be. Sometimes that buys people just that couple extra minutes so they can get to the bathroom without leaking, or if they're trying to delay the time to the bathroom, I've had people be very successful and notice, oh yeah, once I did my 3 fast Kegels, I had like a whole nother hour that I didn't have to even think about my bladder, and I could comfortably wait to get to my 3-hour mark so I could have a stronger bladder. For coordination, you can do an elevator exercise. And an elevator exercise, so this is kind of a test, but also an exercise for how coordinated are my muscles to start and stop. So in a normal Kegel where you clench and lift your muscles, that elevator exercise would be a clench and lift halfway, and then you pause. And then you complete the lift and clench and pause, and then you halfway relax, and then you fully relax. And if you can stop in the middle for each of those directions, kind of stopping on the first floor before you get to the bottom floor or the top floor, then you have good coordination of the muscles. The muscles also need good lengthening and relaxing, as does any muscle in the body. So the pelvic floor, when it relaxes or actually stretches, we can do that slowly with deep breathing exercises. So the pelvic floor muscles that sit like a bowl underneath the trunk of our body, when they tighten, they lift up, and then when we relax, they go back into their bowl formation. If we do a deep breath and we're using our diaphragm properly, then we would lengthen those muscles and they should stretch outward underneath the body. And that is something you should feel similar to a Kegel. So deep breathing and even knowing how to use your diaphragm properly is important in getting those basic needs of how should my pelvic floor muscles be operating. So those are the most important qualities that the pelvic floor muscles should have: the strength, the endurance, the speed, the coordination, and then the lengthening ability. If you had all of those as a great foundation, you're probably not going to have any dysfunction, but all of those can be part of issues of prolapse weakness, bladder control, bowel control, sexual dysfunction, or pelvic pain in general. So hopefully this video has given you that good foundation to understand a little bit of the anatomy and what we expect out of the body on a normal basis, and extra information on where do I go next or how do I advance from these basics will be in a future video. If you have any questions, you're always welcome to call our clinic, come and get scheduled. Whatever your needs are, we're here to help. Our clinic phone number is 719-565-6678. Hope this was helpful. Thank you.